heard everybody talking to you about how you've got weak glutes, your trainer, your physio, your osteo, whether it's back pain, whether it's hip pain, or whether it's knee pain. There's a few different ways that we can check if our glutes are active or not. When we talk about the glutes, there is a few different gluteal muscles in the body. Basically, you've got your gluteus maximus, which is the big glutes that everyone knows about. But also on the side here, you've got your glute medius. Your glute medius is a really important muscle because it actually does a few things. First of all, it will abduct the leg like so. And another big thing that it does that's really important is it actually dynamically stabilizes the hip as we go into single leg. So as we go into single leg, it'll actually lift up and keep us nice and straight. So it's really important when you're walking or when you're running that you have nice strong glutes. The bad news is that these glute medius muscles on the side here can become inactive very easily if they're not trained. A big common thing that can happen is when we aren't using our glutes, we'll actually start to overload the front of our hip, which can cause us a lot of problems. So we often get things like with runner's knees where the actual glute itself will become weak. We'll start to overload all the front here, which then causes our knee to move inwards. As that knee moves inwards, we actually start to get pain across our kneecap, and that becomes even more of a problem. So from that, we can do a couple of tests to actually see if our glutes are working. And for today, we're going to be looking at our glute max, so the back muscle here, and also the side glute as well. I'm going to show you 3 different tests that you can practice at home that'll tell you if your glutes are functioning properly. So the first test is a bridge. It's going to be a little bit of a different bridge that you might not have done before, but it is a really common exercise that's often done not properly that I'm going to show you how to do it properly today. So if we pop onto our back, what I want you to try is feet about a hip width apart, hands on your chest, and just lifting up. If you want, you can have your hands down here when you get to that point, but we're trying to stabilize. And I want you to see where you're actually feeling the actual tensing up. Are you feeling it more in your glutes, or are you feeling it more in your hamstring? If you are already feeling it more in your hamstrings, then that's a big problem. It means you're not activating your glutes on a double leg stance. From there, if we start to have a look at hip stability, then we can look at, are the actual glutes on the side, our glute medius, are they activating? So what you can do here is the same thing, lifting up, arms down, and then from there, trying to raise up one leg. From there, we're having a look at, 1, are we actually activating still through the glute, or is it the hamstring starting to take over because it is a little more intense? And then 2, can we actually activate the glute and keep the hips nice and straight, or are we starting to dip down as we do our test? And the second test we're going to do is someone's ability to single leg squat. Somebody who's got really good glute medius activation or gluteal stability will actually be able to do a single leg squat with ease. They'll be able to shift their weight back into their heel, and they'll be able to have their knee nice and straight as they're coming down for their single leg squat. Somebody who's quite weak in the glutes, you'll actually start to see the actual knees start to shift inwards, and that's a bad sign that the glute's not actually activating when you're doing the single leg squat. So basically you find a table that's around about at knee length, and from there you want to just have your leg just off the ground, and then from there you're going to shift back into your squat. And we're looking to see at the bottom, is that knee coming down and shifting inwards. Have a go at doing 5 and see if anything changes as you do your 5, and be looking for those things as you do your test. So the last test you can do is a side-lying test. Basically, like I said before, the glute muscle can actually do 2 things. It can stabilize the hip, which we've been doing up to this point, but it can also adduct the hip like this, basically moving the leg away from the body. So for this test, what we want to do is we're going to have the person sitting in side lying. We want to make sure that their hips are slightly tilted forward and not tilted up. And basically what we're doing from here is we're abducting the hip and extending the hip all at once. So if we do both those actions by moving it away and back, we should start to feel it right up here in the glutes. Somebody that's really weak in the glutes won't even be able to hold this position without cramping up, or you'll start to feel it in the front of the hip. Because what will happen is you'll start to compensate. So either you'll shift backwards, where your torso goes here and you go into hip flexion, and you'll start to use these muscles around the front of the hip. That's a bad sign that the glutes aren't working properly and that you need to do some glute rehab. So that's assessing to see if you've got a glute medius weakness. In the next video, we're going to talk about some treatment techniques in order to rehab your glute and get your glute a lot stronger. Stay tuned.